Okay. Hi, everyone. I'm so sorry that we had a little technical difficulties with the slides, but we are ready to go. And thank you for being patient and waiting for us. I want to welcome our speakers, Tracy Meehan and Katie Donovan. They're going to talk about AI in action, a behind-the-scenes look at using AI-powered videos for health communications. So. Welcome, speakers, and I'm just going to go through just a very few bit of housekeeping, and then we'll pass it over to you. This is a new platform, Ring Central. So I hope that you all like it and that it's not confusing, but it's pretty simple. You are all muted. If you have questions, please put them in the comments place. And if you need CE credits, you will get an evaluation sent to you after the webinar. And once you reply with your answers to that, then your CE credits will be emailed to you. If you have any questions, just email us, and I'll put the tech email in the chat in just a minute. But first, I want to just welcome to our speakers. Tracy Meehan here is the Director of Research, Translation, and Communication for the Center for Injury Research and Policy. She brings almost 30 years of experience in communication, health education, marketing, and research to her role. Her professional interests center on the effective communication of injury prevention messages and teaching others how to translate their research for non-scientific audiences. In addition, she often serves as an injury prevention expert for mainstream media. Tracy is also our subject matter expert on AI for IHA and the Solution Center. Katie Donovan is the digital communications specialist in the Center for Injury Research and Policy at Nationwide Children's Hospital. Katie has experience in graphic design, video editing, website management, social media strategy, and program management. She visually disseminates child injury prevention messages with user experience, diversity, inclusion, and accessibility in mind. So these two experts here have so much experience behind them, and we're really excited to hear what you guys have to tell us about AI. We'll collect questions, and they will take them at the end. So Tracy and Katie, it's over to you.
Awesome. Thank you, Julie, for the great introduction. And again, sorry for the technology issues. I feel like it's kind of perfect with a presentation on AI and technology, right? So bear with us. Hopefully this will go smoothly. So today we're going to talk about AI in action, and we're going to look at a video that we created using AI and our learning experience through that. But before, I wanted to start by talking a little bit about the importance of visuals in health communication. So next slide. So, research has shown that visuals, like simple drawings, cartoons, and color photos, can improve comprehension for health information. And animated videos can also improve comprehension of health information, especially when it's complex. So Mario, if you click on the ATV image, you can see that is a GIF that we created that we've used. It's simple. It has slides that go through and rotate, but they help with the message instead of having it all in one place. I should also point out that on all of the slides where we have links to resources, you can scan the QR codes and they will take you directly to those resources. Okay, next slide. So I wanted to talk a little bit about the role of collaboration in creating videos. So this is a quote from one of the papers. Visuals can make complex health information accessible to a wide array of audiences, ranging from children and adolescents to adults with lower literacy levels. In the field of health literacy, we do know this. But the second part of the quote was what I thought was interesting. In order for health communication visuals to be accurate, useful, and engaging, multidisciplinary collaboration between graphic designers and health sectors is necessary. And if you've created health communication materials, many of us have run into the fact that we may be trained in messaging, but maybe not in graphic design. And I firmly believe that having somebody who has an eye for photography, design, video creation can be really important in making sure we're getting the most effective messaging out there, which is why we wanted to talk about some of these video options. Next slide. And even more important, visuals are even more important in this online world. So on the left, we see a graph that has the percentage of adults who use the internet in the past 12 months to look for health or medical information. So depending on who your audience is, somewhere between a third and 2/3 of your audience is likely looking for health information online, whether we have it there or not. And on the right, you can see that now, this is from 2020, the numbers probably have gone up. At least 70% of adults have at least one social media account. So people are going online and on social media to look for our information. And we just talked about how visuals can help increase comprehension. So having video or photos is really important, which is why we wanted to look at a video platform. So next slide. So we're talking today about Vyond, which is a video creation program. There are many video platforms out there. We're going to talk about this one because it's the one that we use and the one that we know. We're not pitching this product or even saying it's the best one. We're talking about it because it's the one that we know and use. If you're going to consider using any of these products, make sure to do your homework and find the one that works best for you. And Katie's going to tell us a little bit about what Vyond is so we can all understand the platform. Next slide.
Yeah, so Vyond is a video generation software. Similar to Canva, it is drag and drop. So there's a wide library of visual assets that they provide for you with props, characters, scenes, and other tools that you can use to create and build your video. In their own words, they describe themselves as a video creation studio where you can create relevant, engaging videos that motivate stakeholders to take action. So next slide. And so if you, Mario, press play, you might have to mute them. They might be loud for a second. But here are a few examples of some videos we've created for our outreach program, Prevent Child Injury. We'll have these just running in the background to show you some examples of what typical content from Vyond can look like. So these were created from scratch. We made the storyboard and the body of this video. Then we added in text, design elements, characters, music, our logo to kind of build this video out, and it required a decent amount of software and design knowledge to create them. So these videos are great, but they do take some time and effort to put together. So then next slide.
So Vyond has that capability, and we've used it for years where you have to build it from scratch. And Katie is a graphic designer and has knowledge of how to do those, but that is not true for many people. So fast forward to, or backwards, depending on how you're looking at it, August 2023, Vyond introduced this new feature called Vyond Go. And with that, Mario, if you can click the video on the left, Vyond Go is their AI format. And so you can type a prompt in using Vyond Go, just similar to like what you would do with ChatGPT or any of those other large language models. And within seconds, it will create a script and a video for you. And the design is built in. You don't have to do anything. It creates the whole thing for you. And so we wanted to test to see, the theory behind it is you don't then have to have a ton of design experience. You can actually create these and have it do it quickly. So I wanted to show an example to you just how quickly these programs are. So on the right, you can see the video. I already typed in a prompt and you can see how short it is. So Mario, if you hit play the video on the right, this is a real-time screen recording. You can see I have the prompt in there, and you select the background that you want you have a set list of backgrounds, So you have to pick one that they have, and you pick the tone and what type of vibe you want it to have. And hopefully we will be able to see. Yep. So in the video, we hit go, and this is live, real time, how long it takes to create the video. That fast. Already the video is coming up. You can see that it's started to create it. On the right, you see the script that it's developing. And it looks like maybe this pause, but you can see how fast the video was created. And already you see her starting to talk. So that is an example of how quickly these videos are created. So next screen. You can even translate these videos in up to 70 different languages, including dialects, and a translated voice that sounds like a native speaker. I've tested it out, and it translated the video in a 1-minute video in under a minute, including changing any text that was on the screen. It is incredibly impressive. They do say you need to have a native speaker go back and test to make sure it's correct, but pretty accurate. You do have to pay for an upgraded package for that option, but it can be worth it. If you can have a translation then that's already done and you're just having somebody review it, it can impact how much money it costs to do the translation. On this screen, you can see how easy it is. If you want to change the script, you literally just click on the button and you change the text, and it will change the script, the voice in the video. It is, in theory, that quick. But we wanted to test how good was the quality of the script that was coming out and how much knowledge you needed to actually change any of the background materials. Is it as easy as it seems, or do you need a little bit more effort? So that's where we're going to present to you our case study, next slide, of some work that we did actually creating a video for a project. I did want to point out the picture on the very first slide of our presentation and this one. The two pictures were created with AI using DALL-E and ChatGPT. Okay, next slide. So to give you a little bit of background on the program that we used it for, just so you can have some context of why we were creating the video and how it would be used. So we use this for a program called T4CIP, or Trainees for Child Injury Prevention. It's a year-long program for medical students, residents, and fellows, and it's focused on teaching them about child injury prevention and advocacy. So the goals of the programs are to teach public health approaches and community engagement to these medical students, residents, and fellows, raise their interest in child injury prevention, and teach them how to initiate outreach and engagement activities, both locally and nationally, to prevent child injury. Next slide. So what that looks like is during the year, there are 2 days of action that we ask them to complete. One in May and one in October, and each are on a different child injury topic. In order to prepare for those, they have monthly trainings. They have a group of amazing facilitators that mentor them in small groups. They are asked to do local outreach at their institution. And they are also asked to do social media outreach, either themselves and reaching out to their institution and partners. And they get training on message creation, community outreach, topic specific education, how to be a media spokesperson, how to work with legislators, and all of those types of things to prepare for this day of action. So the video that we're going to talk about, next slide, is looking at part of a campaign that we were getting the word out about the dangers of marijuana edibles to young kids. As more and more states legalize marijuana, we're also seeing more calls to poison centers and visits to hospital emergency departments when kids under 6 are getting into edibles and not realizing what they're eating. This is just from one study, and over the course of that study, we saw the number of calls increasing over 1,375% during the study period. So it's a serious problem, and it's something we wanted to get information out about. So we're going to play the next video, or the first video here, this video 1. And so the idea for this video came about kind of by chance. We had Vion, and we'd been using it to build videos from scratch for a couple of years. But we knew we didn't have time to create one of those videos for this outreach campaign. Vion Go had just come out, and we were curious to see what it was all about. So we typed in a 1-sentence prompt asking it to create a video with 2 parents talking to each other about the dangers of marijuana edibles and what they could do to protect their kids. We didn't know what to expect, and honestly, we didn't have high hopes, but we thought it couldn't hurt to give it a try, and this was the result. So if you can play the first video.
Hi, have you heard about the dangers of marijuana edibles in young children?
No, I haven't. What should I know?
Well, marijuana edibles can look like regular candy or baked goods, making them attractive to young children. If a child eats a marijuana edible, they can experience symptoms like dizziness, confusion, and sleepiness.
That sounds scary. How can I recognize the signs of marijuana edible poisoning?
Some signs to look out for are difficulty walking, breathing problems, and extreme drowsiness. If you notice any of these symptoms, seek medical attention immediately.
What can I do to prevent my child from accidentally eating a marijuana edible?
One way is to store your marijuana edibles in a locked cabinet or container that's out of reach of children. You can also make sure that your edibles are clearly labeled and not easily confused with regular food.
That's a good idea. Do you have any other tips for safely storing marijuana edibles at home?
Another tip is to keep your edibles in their original packaging, with the THC content and dosage clearly labeled. This can help you keep track of how much you're consuming and prevent accidental overdoses.
Thanks for the advice. What should I do if I suspect my child has eaten a marijuana edible?
If you suspect your child has ingested a marijuana edible, call poison control or seek medical attention immediately. It's important to act quickly and get your child the help they need.
Thank you for all the information. I'll make sure to follow your tips to keep my child safe.
You're welcome. It's important to be proactive and take steps to prevent accidental ingestion of marijuana edibles. Let's keep our children safe together.
Okay, so that was pretty impressive. And to answer the question in the chat, yes, that entire script was created based on our 1-sentence prompt. That's it. It did all of that work on its own, pulled from ChatGPT, basically. And we thought it was pretty impressive for a first attempt. We knew right from the beginning that there would be things that we would want to change. For instance, we're in injury prevention. And as you see right here, the 2 people on the bikes aren't wearing bicycle helmets. So little things like that. There were some pretty dramatic emotions, sweating and, sparkles and things like that, which Katie will talk about later. But it was pretty impressive for a first attempt. We're going to talk through this presentation about the types of changes we wanted to make and why, and how easy or difficult they were. So you'll get some more information about that. This video was created in September, October of 2023. The voices still are a little bit robotic. They're actually better for some of the other languages, weirdly. But they also now have a feature where you can go in and record the voice yourself and upload it. But that's more technically challenging. So we wanted to try and make it as easy as possible. But yes, I fully expect there to continue to be improvements as you go along. Okay, next slide. So as I mentioned, we wanted to use this video with our T4CIP program. So we had to really think about who our audience was going to be for the video and what the goals were for the video. So we talked a lot. This first video was for parents talking to their friends. We also talked about maybe having a parent talk to their adult family member, or a parent talking to maybe a teenage child who was possibly bringing these products in and hiding them and having their younger siblings getting into them. We talked about maybe having a video aimed at legislators, one aimed at people who were distributing marijuana edibles. But ultimately, for this particular project, the group decided to have the video actually aimed at other doctors. This is a newer phenomenon, and many of the doctors really aren't trained yet. And even though they're now starting to see more and more kids in their emergency departments and clinics and things like that have been exposed to this. So in the end, we ultimately went with an audience of other doctors, and you'll see how that comes into play. Next slide. We also really thought about what we wanted our audience to learn. So this is, as I mentioned, a newer topic. And so we wanted them to really understand the dangers of marijuana edibles to young kids. If you're around my age, 50 plus, the marijuana that was in high school when I was in high school is very different from the marijuana that is around now. Now it's much more potent, and even a little bit can lead to really serious injuries and issues. So we wanted to talk about that, but we also wanted to role model for doctors how to talk to parents about this issue in a non-judgmental way, where you're giving them enough information, but not too much, and giving them something that they can actually do something about. So next slide. The other piece of this is not only are we developing a video to an audience of other doctors, but I also wanted to use this as a training tool for the people in our program. What do you need to think about when you're creating health communication materials? We had to show them things like it's important to show what you're talking about in the text and how to reinforce the message, and making sure that the people in the video and the situations are relatable. We also were training them on the choice of language, making sure that the language that was used in the video was not too technical, and that we weren't just telling them, ooh, this is dangerous, but then not telling them how to fix it or what they could do to protect their families. We also wanted to teach them about how to look at reading grade levels of text. Even though this is speaking and not text, we can look at the script and teach them a little bit about that. And it was really important for us to talk about this as a role modeling kind of concept. So we were teaching as well as learning ourselves. Next slide. So we're going to start with the script changes first. So you can go to the next slide. The great feature about this is you can actually download the script. So we downloaded the script into a Google Sheet that we could share with our trainees. I know you can't really see it super well, but the concept is the script is there. And then that's in the kind of original text column. And then we asked our trainees to go in and give comments and feedback on the script, which is what you see in Student 1 and Student 2 column. So what we found was that they were keeping the video, the text, the same length, same number of interactions. They were making some small changes to the script, but I think they weren't really sure of what types of changes they were allowed to make. And we had to really challenge them to think about how a real conversation with a parent might go. So if you go to the next slide, I actually put in some notes to them. The highlighted are areas that, in terms of health literacy, the types of things we wanted to look at. So I wanted them to think about modeling how a doctor could really bring up the topic. The way the next version of the video was created, it made it seem like the visit was just for that. And probably realistically, very few parents are going to set up an appointment to talk to their doctor about marijuana edibles, right? This is going to have to be something that a doctor brings up with a parent. So we talked about that. We talked about how a real parent might respond and the words they would use and how they would say things. So making it more conversational. I talked to them about how when I was reviewing the script, I actually went through it 3 separate times. I went through it once as a public health person, making sure the messages were getting across and the important things, things that they could do were getting across. I went through once as a doctor. So what, as a doctor, would I want to talk to a parent about and how would I bring that up? And I went through as a parent. As a parent, what kinds of questions would I ask? What would I be thinking about? So I had to teach them to kind of think about it that way. I also used the words feel empowered to make substantive changes. So they weren't feeling that they were stuck to having to have the same number of interactions, and they could think about it on a broader level. Kind of ending with AI can be a great start, but it will never replace what we know as a healthcare provider about the human interaction piece. So next slide. So on this slide, you can see kind of a pull out of some of the recommendations I made. And what you need to see or here is that I went through and really didn't limit myself to the number of interactions. I made sure I was changing some of the things we talked about earlier in terms of language and making it more conversational. I did make it not quite perfect so that I would have some places where we could work with the trainees together to improve it even more and have a better solution, which is the shorter version column on the right. We ended up cutting out a bunch of information, tightening it up, making it a little shorter. Our goal was to get the video under 3 minutes. Any more than that, and we thought we would lose people's attention span. So we really were trying to get it under 3 minutes. So on the next slide, we talk about these are the types of things we changed. We made it more conversational. We talked about plain language and how technical and complicated words and sentence structures can have an impact. We added some data to help parents understand why this would impact them. And I taught them about the health belief model. And we talked about some of the components of that. So you'll see perceived susceptibility, self-efficacy, and cues to action. I wanted our doctors to think about those components when they're thinking about constructing messages. We focused on recommendations that parents would feel they could do themselves, so not making it too difficult for them. And we pointed out situations where parents would need to take action. So on the next slide, okay, you're not gonna be able to see this, but we ran it through the original script. We ran through, and it was at a 15 reading grade level. And then we ran it through after my first round of changes, and it was at 8.5 reading grade level. And we went from reading ease of 19.3 in the first draft that the AI created to 70% reading ease level in the middle. And then by the time we made the final round of changes, it got down to a 6.8 grade reading level with an ease of 71.5%, which we thought was pretty good, especially for doctors. So that was kind of, in a nutshell, the script. And Katie is going to talk to us about some visual changes. So next slide.
Yeah, so then when it came to kind of the visuals of the video, we decided to make a couple changes to match our vision. What was great about the AI function is that it was able to generate a storyboard for us. So with the click of a button, we had a video of two people having a conversation across the table. It built out a mix of frames that slowly zoom in and out with wide angle shots, close-up shots, clips that include expressions from characters, props, and all that. So storyboarding and building out the skeleton or body of this video could have taken a couple hours, but with the help of the AI function, we now have a video that, with a few tweaks in our knowledge of health comm best practice, we could use to reach our audience. So then next slide. To start the video generation process, we put ourselves in the shoes of a parent and pediatrician at a usual checkup appointment and decided that these conversations usually happen sitting down and across from each other. So Beyond at the time didn't have a layout option that matched our vision of what this doctor's office visit might look like. So we decided to go with the breakfast table, knowing that we could change the background and the props and the characters to kind of match what we were thinking. So then next slide. So here is a brief kind of before and after shot of what we started with and how we ended. So you can see we started with this woman and man on the left, and then we ended with a doctor, a parent or caregiver, and then a patient sitting on the patient bed. So we were pretty thoughtful with who we chose our characters to be. We wanted to make sure we had a diverse representation of people in our video. We were thoughtful about what stereotypes we might perpetuate with these choices, like who the doctor is and who you think a doctor might be, the type of person you'd expect to talk about marijuana edible storage with, and so on. So we know that as marijuana becomes legal in more states, more and more people are bringing it into their homes and it's becoming more commonplace. So and it's also being used for medical purposes. So not that this is ever true, but you can't really tell by a person's appearance if they might be a marijuana user or not. So we wanted to make sure that was represented in our video. And then kind of final piece of that is we also have messaging that, even if you yourself don't have marijuana edibles in your home, someone who visits might. So we wanted to reach that audience too and have them hear this message. So yeah, we chose our 3 characters on the right. And then next slide. So here's a little behind the scenes look of how we edited the characters. When it came to this, the replace button was our friend. Beyond has an option where you can choose an object and then replace it with something else. And the object will keep the dialogue, the camera angle, the expression, the direction it faced, its layer in the scene, all of that. So this was super nice to just go in each frame and replace the character with the character we had chosen. So to change to the doctor, we went through the business friendly tab to healthcare and then selected from this cast of characters. And what you see on your screen is just some of the available choices. As you can see, they have different genders, different races and ethnicities, different body types. So they do a nice job of having a pretty diverse kind of representation of people. So another note is we kind of chose all of our props and kind of visual assets in that business friendly tab because Vyond has 3 options of business friendly, this whiteboard animation, and a more contemporary look. So to keep it more polished, we kept it all in the same kind of illustrative style. So then next slide. So as you saw in the original video, a couple of the characters had some pretty theatrical emotions and reactions. And these expressions were assigned by the AI generator based on AI's perception of the dialogue and how they think the character would react to what they're saying. So these expressions may fit in other types of videos, but we ultimately decided didn't fit the tone of ours. So that's something we did have to go back and edit pretty heavily. You can change the expressions and the emotions, and we leaned towards more neutral ones. Sometimes we chose the emotion anticipation while they were kind of in the middle of conversation. So that is something we did kind of have to revisit. But next slide. Here's another behind the scenes look of how we edited those. As you can see, you can kind of just select the character, pick the emotion and the direction it's being, the character's facing. So you can see this man was sad here. So we altered that, and you can have them face the camera, face left or right. So since they're having a conversation, we have them facing each other. And then also just to note other features of Vyond, they you can assign them an activity too. So you can have them like kick a soccer ball or take a bite of food or jump up and down. And that can fit other videos in different tones too. But we decided since ours was more focused on the conversation, we didn't use those, but also another option. All right, so the next slide. So here's a closer look of the room setup before. Like I said earlier, we ended up going with this breakfast table to mimic a conversation. So once we chose the characters, we went ahead and edited the scene. So as you can see, it's kind of just a table in a kitchen, and maybe a suburban home. And we decided to kind of alter that. So next slide. As Tracy mentioned, we decided that this conversation was going to happen in the doctor's office. So we wanted to get as close as we could to what parents and caregivers and pediatricians would expect to see while they're in an office visit. So Beyond does have a clinical setting that we could kind of browse through, and they have like a hospital hallway, a lobby, or a waiting room, rooms with a window, without a window. And we ultimately went with this kind of empty looking room with the thought that we could build it out how we envisioned it. So next slide. So then we started modifying the room. So again, replace button was our friend. We picked out items that would be found in a doctor's office. So we switched out the breakfast table chairs for a doctor's stool, the doctor's office chair for the parent, and then a patient bed. We switched out the breakfast table for a rolling laptop station. We added the tools on the wall, the sink cabinet that I feel like I can hear opening and closing in a typical doctor's office room. So we also leaned on our trainees for feedback too. I've personally never been in a clinician's shoes, so they offered some really great insight to what to expect in this kind of conversation. So at the beginning, we actually had the child sitting behind the parent. So the parent and the doctor were closer. So the trainees pointed out that mom should probably be behind the kid so they feel included in the conversation about, their health and their checkup. And then it's also just safer to have the child in their sight, and a parent would probably never have their back to their child. So we made those edits. We also added a teddy bear to kind of help nudge the viewers in the right direction about how old this child was, because we were a little limited on the age and kind of representation of kids in Vyond's library. They really only have one option for a kid. So when we talk about this topic, we're usually talking about younger children. I know Tracy mentioned 6 years old and younger. So we added that teddy bear to kind of nudge the viewers to think like, oh, this is a younger child. So yeah, the next slide. So it's important to note that when you use AI programming for video creation, you don't get to control what scenes it puts into the video. So one thing in philosophy that Tracy and I have is that it's really important not to just show people talking about the issue, but to illustrate parts of our messaging, like specific calls to action or symptoms to look for. So we always want to model the right behavior. So we had to add some scenes. So one of those on the left, we have possible symptoms. So we added a clip that shows that child representing or illustrating those symptoms, like being tired or lethargic, confused, dizzy, shortness of breath, fast heart rate. Then we added the scene to show one way to safely store marijuana edibles so the child can't get to them. So we have that lockbox with a marijuana leaf and then a lock, and we just uploaded that lockbox up into Vyond. And then we also have a call to action. Here's what you can do if you suspect your kid has eaten an edible. So, call Poison Center or call 911. So I was able to upload certain images and add text and transitions to build these out. And matching our T4CIP branding and colors. So speaking of that, next slide. The final piece we added to the doctor's office room is this poster we created for the campaign. This was a poster that we created with doctors and trainees in mind that they could hang in their clinics and exam rooms to use while they're counseling families, or just have a patient kind of browse over while they're waiting. So we added this poster on the wall in the background to model that action being taken and what that might look like. So yeah, that was another piece of editing the room. So next slide. So lastly, you can only cover so much in a quick informational video. So we like to be thoughtful about the fire hose approach or overwhelming our audience. So we try to walk that line of providing important information and actionable steps without, overwhelming our viewers. So we wanted to keep the video under 3 minutes. So last slide, we have a link just to learn more. We added a bit.ly link so it's easy for them to remember. And then we uploaded our logo. So usually that's just a kind of best practice we like to follow, is giving them somewhere to go. So yeah, that kind of wraps up the visual changes we made.
Before we go to actually showing you what the final video looked like, I wanted to address some of the questions in the chat. So the video we did want to keep under 3 minutes, and I do want to remind everybody that the audience for this video was actually other doctors, not the patients themselves. We were trying to teach doctors how to talk to patients, so it's a little bit different. I have seen some research that if you are creating videos on health messaging, you should keep them to 6 minutes or less. After 6 minutes, it starts to lose its effectiveness in terms of being able to modify behavior. And I believe that was in the Paulson research, but I can double check that and get back to you guys if anyone is interested in that. But we did want to keep it on the shorter side for attention span. The objects in the video, when you select an object to get put in, you can scale it to different sizes. It doesn't automatically go in scaled. You have to kind of mess with it a little bit, but it's pretty easy to do. Let's see. Yes, all of the edits that we made were made within this AI platform. We wanted to try and see how easy it was to stay within that platform. Actually, is that true, Katie? Did you have to make some of the right behavior slides?
Those are all made in the platform, but the lockbox, that's something I made myself in like Illustrator. So that is something I made outside of the platform, but yeah.
Okay, perfect. So at this point, I think it'll be great to show what the final video looks like. So if you can play video 2, and then I'll wrap up with a few answers to some of the other questions.
Thank you for coming in today. Everything is looking great. Before you leave, there is one more thing I wanted to talk about. Since marijuana has become legal in some states, more people are bringing edibles home. This has led to more young children ending up in the hospital after accidentally getting into an adult's marijuana edibles, so we are talking to all our families about this new danger.
I haven't heard about this. Can you tell me more about what I need to know?
To a kid, marijuana edibles can look just like regular candy or baked goods. It is easy to see how a child might want to eat one if they find it and not realize it is something that could hurt them.
Oh, I could definitely see that. But really, is it that big of a deal? He might get a little silly, but it wouldn't really hurt him, right?
Actually, marijuana is much stronger than it used to be. Eating just one gummy could be enough to cause a child to end up in the hospital with some pretty serious symptoms. And we know that many children will eat much more than just one.
Wow, I had no idea. What kinds of symptoms would he have if he accidentally ate an edible?
Some signs to look out for are breathing problems, a fast heart rate, if he seems a lot more tired than usual, or if he's dizzy and having trouble walking. He could start throwing up or even have some more serious symptoms like having a seizure or going into a coma.
I definitely don't want him to go through that. What can I do to prevent this from happening?
It is best not to keep edibles in your home when you have young children. If you are going to have them, store them in a locked cabinet or container that is up, away, and out of reach of your child. Keep edibles in their original packaging with the THC content and dosage clearly labeled. When you are going to consume an edible, make sure your child will not be around and only take out what you will be eating so the rest stays locked safely away.
Those sound like great recommendations. Is there anything else I can do?
You can also share this information with other adults in your child's life so they know how important it is to lock up edibles if they have them. This includes family, friends, and even other parents.
I'll definitely make sure to talk to everyone about this. What should I do if he does accidentally eat an edible?
Either call Poison Control at 1-800-222-1222 or call 911. Make sure to tell them he may have eaten an edible so they can treat him effectively.
Thank you for talking to me about this today. I had no idea how serious this could be.
You're welcome. By talking about things like this ahead of time, we can keep kids a little safer and help parents know what to do if it does happen.
Awesome. So I think you can see the differences between the two videos, and we were pretty pleased with the way that it came out. If you can go to the next slide. So we did get some questions about how we tested this and who we tested it with. So we did get feedback from doctors, and these are just two example of quotes. One was of someone who had been involved in the process. It's much more conversational, really sounds like how a doctor might talk to a patient. And then one was from one of our trainees who said, before watching this video, I thought it would be awkward to bring up edibles to a parent. And now I can see how easy it can be. And we got, we had other feedback like that. We have not been able to test it with parents and patients just quite yet, but hope to be able to do that in the future. This was, kind of our learning process to see if it's even feasible and how long it would take. So it's a starting point for us. In terms of, let me just make sure I get back to some of these questions. So yes, we did revise the script. So you can download the script and import it back in pretty easily is something you can do. You can also change it right in the program, which is pretty easy. In terms of other platforms, so Canva does have AI in it now, and it does have some video. You probably could do video, but to be able to do something like this would be pretty difficult in Canva. It would have to be much shorter, and you're going to be much more limited. So there are some video capabilities in Canva, but if you want to do a true video like this, I really think you need to use some type of video platform like this. It'll be much easier. In terms of how this video was used, so you can download it as a video, which we did, and then we uploaded it to our YouTube channel. So then people could use the link to either embed it on a website or in a training or a PowerPoint presentation. You can also link to it on social media that way. So putting it someplace like YouTube is super easy to do and makes it accessible to everybody that way. In terms of doing our homework for a video creation program, so some of the programs require more skills than others, and really looking at, you can do free trials. Usually they'll all have like a 7-day trial or something like that. So I am very fortunate. I have Katie on staff who has background and is able to do more of this work. If I had to create the video, even the one we did with AI, with all the changes we needed to make, it would have been difficult for me to do it without Katie on board. So just kind of being aware of some of those, thinking about how you're going to use it, what the costs are. This program at a basic level is around $25 a month. In order to have the more advanced AI and translation, I believe it's around $50 a month. So it just depends on budget and what that looks like for you. Somebody asked, is it the fact that it's so easy concern? So, it's a double-edged sword. I actually think it's pretty cool that it did such a good job with the information. I will caution, you really have to double check to make sure the information is actually accurate. So you really need somebody that is the health communication topic expert to review the content of the video to make sure it's accurate. We've done some testing with ChatGPT on other topics, not video related, and it puts out information that sounds really good, but isn't actually accurate. So you have to be really cautious about that. I do think some of these, this program, you will be able to see in some aspect that there was a human in the loop is what they call it. But I do think moving forward, having transparency about when you're using AI and what that looks like is going to be really important, because yes, as this speed of this advances, it is going to be harder and harder to tell what was AI created and what wasn't. So I think as a field, we need to have some discussions about that. If you go to the next slide, just so we make sure we get through the last couple slides. So I just want to give some final thoughts on these videos. They are quick, they are easy, and depending on how many changes you need to make, you could actually do a video and use it without a lot of skill. But right now, we still are having some robot sounding voices, which someone pointed out. You do need someone with editing skills if you want to make more advanced edits or add branding or things like that. So things to be aware of. And in terms of health literacy, I think most of what comes out is still going to need some work. It's never going to get it to the level that we as health literacy specialists want to get it to. So can't just put it in, spit it out, and have it be exactly perfect. But the amount of time it takes Katie to create a video from scratch, like you saw at the beginning, versus the amount of time for this, even though we had some pretty substantial edits, dramatically different. So I think there's some exciting potential there. If we can create videos much more quickly with not as much editing skills, it's definitely opening up a world of possibility for us. Next slide. I just wanted to point out, if you like this and you really want to go behind the scenes a little bit more, see what this program looks like, and actually like kind of get some more hands-on experience, Katie and I are going to do a workshop at the upcoming IHA virtual conference, where we're hoping to actually create a video live from a prompt from somebody in the audience, have Katie do some actual live edits and change the language of the video, showcase some of the newer features and things like that. So we would encourage you to come to the Health Literacy Conference. And then just next slide with our contact information. We love questions, reach out to us for sure. And if you want to put the next slide up, there's information there, and I'm going to flip over to answer some of these questions. So plain language, you can ask the AI program to write it at a 6th grade reading level or whatever level you want, but it is not 100% accurate. So you still need to go back and do that. It can't quite do that yet. So we still need to have a role in there. To my knowledge, Vion does not have a readability tool in and of itself, but if you're using the AI prompt, you can put that in there. But again, those are not perfect. They are not using any of our, SMOG or FleshKK or any of, it doesn't use that. You can get it more simple by telling it, say that again in a simpler way, but it's a little bit harder with these platforms. So, can you go back one more slide for contact information? And yes, you can reach out to us for sure. We would love to talk to anyone. I think I got most of the questions from the chat, but if I missed anything, let me know. And thank you all for coming.